Welcome to our YouTube channel Medical Subjects Made Easy. Epidemiology of polio. So sad to see this type of images, isn't it? Situation, definition of poliomyelitis, epidemiology of polio, the Global Polio Eradication Initiative, challenges to stay polio-free country. Key facts: poliomyelitis, mainly affects children under 5 years of age. Poliomyelitis comes from the Greek word for gray, polio, and myela, meaning spinal cord. The Latin suffix itis refers to inflammatory diseases. Among children who are paralyzed by polio, 30% make a full recovery, 30% are left with mild paralysis, 30% have medium to severe paralysis, 10% die. Polio is an acute infectious disease. Epidemiology, agent, poliovirus, type. 3 serotypes, type 1, type 2, type 3, reservoir. Man-infectious material. Feces, oropharyngeal secretions, incubation period. 7 to 14 days, 3 to 35 days, period of communicability. 7 to 10 days, host age. 6 months to 3 years, environment. Rainy season, June to September, mode of transmission. Fecal, oral route, droplet infection. The virion consists of a single strand of RNA containing genetic information and a protein code. Humans are its only natural host. The poliovirus is a member of a larger family known as picornaviruses, which also includes rhinoviruses, such as influenza, and the hepatitis A virus. Polio belongs to the enterovirus subgroup, made up of over 70 viruses that infect the intestines. It is one of the smallest RNA viruses, measuring around 25 nanometers in diameter. Inapparent, subclinical infection. This occurs approximately in 95% of poliovirus infection. There are no presenting symptoms. Recognition only by isolation. Abortive polio or minor illness occurs approximately in 4 to 8% of the infection. It causes only a mild or self-limiting illness due to viremia. The patient recovers quickly. Non-paralytic polio occurs approximately in 1% of all infections. The presenting features are stiffness and pain in neck and back. The disease lasts for 2 to 10 days. Recovery is rapid. Paralytic polio occurs in less than 1% of infections. The virus enters the brain and causes varying degree of disability. Treatment: no specific antiviral agent is available. Treatment focuses on management of complications, e.g., meningitis, abnormal cardiac rhythms, and heart failure. Intravenous administration of immune globulin may have a use in preventing severe disease in immunocompromised individuals or those with life-threatening disease. The Global Polio Eradication Initiative. Objectives: to interrupt transmission of the wild poliovirus as soon as possible and certify all regions polio-free by the end of 2005. To implement the polio endgame program of work, including containment of wild poliovirus, global polio-free certification, and the development of a post-eradication immunization policy. To contribute to health systems development by strengthening routine immunization and surveillance for communicable diseases. Strategies: high infant immunization coverage with 4 doses of oral polio vaccine in the first year of life, supplementary doses of oral polio vaccine to all children under 5 years of age during National Immunization Days, NIDs, surveillance for wild poliovirus through reporting and laboratory testing of all cases of acute flaccid paralysis, AFP, among children under 15 years of age, targeted, mop-up campaigns once wild poliovirus transmission is limited to a specific focal area. Before a WHO region can be certified polio-free, 3 conditions must be satisfied. 1. At least 3 years of zero polio cases due to wild poliovirus. 2. Excellent certification standard surveillance. 3. Each country must illustrate the capacity to detect, report and respond to imported polio cases. Laboratory stocks must be contained and safe management of the wild virus in inactivated polio vaccine, IPV, manufacturing sites must be assured before the world can be certified polio-free. Global priorities to stop transmission of the wild poliovirus. 1. Substantial external financial resources are required to support the efforts of developing countries to eradicate polio. 2. India is the highest priority country, because it has the highest number of cases in the world, 83%, and for the first time in the initiative's history, previously polio-free areas were reinfected. 3. As the world is nearing polio-free status, effective surveillance becomes even more important. 4. To rapidly mount massive immunization response campaigns to manage any wild poliovirus importations quickly and efficiently in polio-free areas. Case definition. In the Global Polio Eradication Initiative, PEI, acute flaccid paralysis is defined as any case of AFP in a child aged less than 15 years, or any case of paralytic illness in a person of any age when polio is suspected. Acute. Rapid progression of paralysis from onset to maximum paralysis. Flaccid. Loss of muscle tone, floppy, as opposed to spastic or rigid paralysis. Weakness. Loss of voluntary movement. Any case meeting this definition undergoes a thorough investigation to determine if the paralysis is caused by polio. Components of AFP surveillance detect the exact geographic locations where wild polioviruses are circulating in the human population. All cases of acute flaccid paralysis in children aged less than 15 years are rigorously investigated by a trained personnel, with collection of stool specimens to determine if poliovirus is the cause of the paralysis. Analysis of the location of polioviruses isolated from AFP cases allows program managers to plan immunization campaigns, pulse polio immunization, to prevent continuing circulation of virus in these areas. Components of AFP surveillance. 1. The AFP surveillance network and case notification. 2. Case and laboratory investigation. 3. Outbreak response and active case search in the community. 4.60 day follow-up, cross-notification and tracking of cases. 5. Data management and case classification. 6. Virologic case classification scheme. 7. Surveillance performance indicators. 7. Samples are considered adequate if both the specimens are collected within 14 days of paralysis onset and at least 24 hours apart, of adequate volume, 8 to 10 grams, and arrives at a WHO-accredited laboratory in good condition, i.e., no desiccation, no leakage, with adequate documentation and evidence of cold chain maintenance. Current challenges in the world: surveillance of AFP cases, zero reporting, access to immunization in health facilities, illegal residents, location and function sentinel sites, trained personnel on AFP case definition, imported cases. Polio-free is not a granted, blanket check. We can be reinfected. Thank you.